Hello, my name is Jill Lyons, and I'm one of the 4 nurses from the Multiple System Atrophy Trust in the UK, and I will be talking about fatigue in multiple system atrophy. Fatigue is an overwhelming sense of tiredness, lack of energy, and feeling of exhaustion. Fatigue is a common problem in life-limiting conditions. From our needs survey 2019, we found that 96% of people living with MSA reported fatigue. So it's a very common symptom. It also becomes a more significant problem as MSA progresses. People often describe living with MSA as effortful and that everyday tasks are challenging. They also often find they can only concentrate on and manage one thing at a time. Fatigue can be described as 2 types, primary and secondary. Primary fatigue is fatigue which is caused directly by the MSA. One type of primary fatigue is lassitude. This is the extreme tiredness caused by the MSA that can even occur when you have just woken up. Another type of primary fatigue is brain fog or cog fog, short for cognitive fog. This is when your brain has difficulty with planning, understanding, or concentrating. Another type of primary fatigue is heat sensitivity. Heat sensitivity can cause people with MSA to feel more tired in hot weather or when exercising. This can be helped by a cool environment or a cool water spray. Secondary fatigue is fatigue that comes as a result of having some of the other symptoms of MSA. These can include sleep problems, depression, anxiety, nutrition and hydration inadequacy, unhelpful surroundings, and pain. These secondary causes are interrelated. We will now look at each of these. Sleep. Sleep and how to improve it will be discussed in the sleep webinar. But if you're not sleeping well at night, this will add to the fatigue in the day. If you need to sleep in the day, sleep after lunch and before 3 p.m, as this is less likely to prevent you sleeping at night. Depression. Depression is another symptom that can affect fatigue. Depression is common in MSA. If the person with MSA thinks they have depression, they should talk to their doctor or other healthcare professional. Often family members recognize low mood or depression before the person themselves. They should gently encourage the person to speak with their GP or other healthcare professional. The healthcare professional can screen for depression using a depression questionnaire. If indicated, they should then be referred for treatment. Depression can be improved with talking therapy, cognitive therapy, and medication. Exercise, diet, and daily structure can also help. It's important to do at least one thing you enjoy every day. Anxiety. Anxiety is another interrelated symptom. Anxiety and stress can be part of an unhelpful cycle. Anxiety and stress can cause fatigue, and fatigue can cause anxiety and stress. Having MSA in itself can be stressful. Talking therapy, cognitive therapy, and medications can all be helpful. Breathing techniques can also help. The emotional support resources on our website are also very useful. Nutrition and hydration. Nutrition and hydration are particularly important in managing fatigue. A good balanced diet, including fruit and vegetables, legumes, protein and carbohydrate is important. If the person with MSA has difficulty with swallowing, they should be referred to the speech and language therapist. If there is a significant weight loss or gain, they should be referred to the dietitian. 6 small meals a day are suggested to avoid a drop in blood pressure after eating a larger meal. Too much sugar is to be avoided to prevent highs and lows in blood sugar level. A good diet can also help to avoid constipation, which can cause fatigue. Hydration is particularly important in MSA to help low or dropping blood pressure. Plenty of water is encouraged, but if this is difficult, think about foods that have high fluid content. Drinking fluids regularly and choose fluids that you like. Not too much caffeine, sugar, or alcohol. Surroundings. The surroundings of a person with MSA can also affect fatigue. It may be too hot or too dark or too physically demanding. The environment needs to be the right temperature, well lit, and without too much clutter in order to decrease fatigue. The environment may also be too physically demanding. It may be necessary to adapt the environment to make this easier. An appropriate property would be accessible with single floor living, with a living space and sleeping space and wet room all on the same level. Pain. Pain can cause fatigue. It also affects other symptoms such as sleep and exercise and can thus increase fatigue. Management of pain is complex, including both medication and non-medication methods, such as relaxation, heat, and TENS. Referral to pain management specialist or palliative care consultant may be appropriate for expertise in managing pain. Breathing. If you're experiencing problems with your breathing, including breathlessness or sleep apnea, this may be making you more fatigued. You should be referred to a sleep or respiratory specialist if you have sleep apnea. CPAP may well be recommended. Many people find using this overnight means they are less tired in the day. Postural hypertension. Very low blood pressure or blood pressure where there is a significant drop on standing or sitting up can worsen fatigue. Measures to manage blood pressure can help. Please see our blood pressure management leaflet and fact sheet for how to manage postural hypertension. Here is a screenshot of our Living with Postural Hypertension leaflet, which can be found on our website, along with many other useful fact sheets and resources. Other causes of fatigue. There may also be other causes of fatigue. If the fatigue is of a sudden onset, it could be due to an infection, commonly a urinary tract infection or a chest infection. The GP should check for these and treat promptly and appropriately. The GP can also check for anemia or hypothyroid or other possible causes of fatigue with blood tests. Fatigue diary. A fatigue diary or a rest, activity, sleep planner can be useful in looking for a pattern in the fatigue and working out a plan. I'm sure you all will have experienced doing too much so that your energy account becomes depleted and low. Planning rest periods during the day is called pacing, and this is very important. Rest periods might include breathing exercises, relaxing music, sleep, or yoga. Many people with MSA find it difficult to pace themselves and view this as giving in to the MSA. It is not. It is important to talk to your family and friends about managing your fatigue so they can support you with managing it. You may also find it helpful to talk to a counsellor as you come to terms with the changes MSA brings. Activity. Activity can be physical, emotional, cognitive, or social. Each can cause fatigue. Some physical activity or exercise is important each day and may itself decrease fatigue. Your activity diary can help you decide what things you will do, delegate, or delete. Here are some unhelpful thoughts. I should be able to do all the things I was doing before. Yes, but. Yes, pacing makes good sense, but I don't have the time. Comparing. Everyone gets tired and they keep going. Negative. I'm useless because I can't do all the things I used to do. Over-interpreting. This fatigue means MSA is taking over my life. Talking to friends and family or a counsellor can be helpful in addressing unhelpful thoughts such as these. Ideas to conserve energy. In the bathroom, you might consider electric toothbrush or a shower seat. In the bedroom, front fastening clothes, non-iron clothes. In the hallway, a mail basket by the door, on the door, a helping hand aid. In the lounge, a phone and remote control by your chair, and perhaps internet shopping. In the kitchen, ready meals, microwave food, a perching stool. In summary then, we've looked at how common fatigue is. We've looked at primary and secondary causes of fatigue and how to address them. We've considered other possible causes. We've looked at how using a fatigue diary can be helpful in developing a management plan. And we've looked at the importance of pacing and how thinking affects our ability to pace ourselves and manage fatigue. Thank you.
Welcome to this webinar on sleep issues in multiple system atrophy. My name is Samantha and I am one of 4 nurse specialists at the MSA Trust based in the UK. We will cover the following topics in this presentation: normal sleep patterns, REM sleep disorder, sleep apnea, stridor, nocturia, and restless leg syndrome. Good sleep is vital to our mental and physical well-being. Experts tell us we should be getting between 6 and 9 hours of sleep every night. Our sleep goes through different cycles known as circadian rhythms, but people with MSA may have several sleep issues, one of which is not getting adequate deep sleep, so they often wake unrefreshed. Sleep hygiene can help towards getting a good night's sleep, and we will look at this later. If you see your GP or a sleep expert, they may ask you to keep a sleep diary to help them diagnose your sleep problems. It can identify factors such as stress, sleep apnea, or any medications that may be affecting your sleep. If you wake in the morning regularly with a headache, this could be an indication of low oxygen levels in the bloodstream. Talk to your neurologist, as you may need to have an overnight sleep assessment. Heavy snoring should not be ignored. It may be stridor, which can indicate problems with the vocal cords. It needs addressing by your specialist. In health, our sleep consists of 5 stages. The first is light sleep, when we can be easily awakened. The second stage is where our brain waves are slowing down with some eye movements. Our heart rate slows and our body temperature drops. The third stage is where delta waves begin to appear. A delta wave is a type of high amplitude brainwave, and people become less aware of their external environment. The fourth stage is deep sleep, when it is difficult to be woken easily, and if we are woken, we may be disorientated briefly. During deep sleep, the body repairs and regrows tissues, builds bones and muscle, and works on strengthening our immune system. These 4 stages are all referred to as non-rapid eye movement sleep. They can last from 5 to 25 minutes. The 5th stage is rapid eye movement, or REM sleep. During REM sleep, our eyes move rapidly in a range of directions, but don't send any visual information to our brain. We typically dream during REM sleep, and then the cycle starts all over again. Usually, REM sleep happens 90 minutes after we fall asleep. The first period of REM typically lasts 10 minutes. Each of our later REM stages gets longer, and the final one may last up to an hour. Our heart rate and breathing quickens. During REM sleep, we can have intense dreams since our brain is more active. REM sleep is important. Stimulates the areas of the brain that help with learning and memory. REM sleep behaviour disorder, RBD, occurs during REM, or rapid eye movement. During REM sleep, the body experiences temporary paralysis of most of the body's muscles while the brain is active and dreaming. This allows us to dream quietly and safely throughout the night. For people with REM sleep behaviour disorder, paralysis does not occur during the REM stage. Instead, their body and voice perform their dreams while they remain asleep. They may kick or punch out, sometimes disturbing their partner. They may laugh, talk, shout, cry, or curse in their sleep. Commonly, they awake not feeling refreshed from sleep, as they haven't experienced enough deep sleep. If they regularly wake with a headache, this may be an indication that oxygen levels have dropped overnight, and a referral to a sleep study centre may be required for assessment and treatment. The person living with MSA is usually unaware of this behaviour, and diagnosis is made from their partner's observations to the neurologist, as well as from the sleep study. During this test, sensors monitor your heart, lung and brain activity, your breathing patterns, arm and leg movements, vocalizations, and blood oxygen levels while you sleep. Typically, you will be videotaped to document your behaviour during REM sleep cycles. Treatment may be melatonin or clonazepam medication, which is a muscle relaxant. In sleep apnea, your breathing stops for short periods and restarts spontaneously while you sleep. Your partner may notice your breathing stopping and starting. You might be making gasping, snorting or choking noises, waking up a lot, or you may display loud snoring. During the day, you may also feel very tired, find it hard to concentrate, have some mood swings, or have a headache on waking. Obstructive sleep apnea occurs when the muscles that support the soft tissues in your throat, such as your tongue and soft palate, temporarily relax. When these muscles relax, your airway is narrowed or closed, and breathing is momentarily cut off. Causes include being overweight, smoking or drinking alcohol, in particular late at night. Central sleep apnea occurs when there is a problem with the brain's system for controlling the muscles involved in respiration, leading to slower and shallower breathing. Mixed sleep apnea can also occur. This is when a person has both obstructive sleep apnea and central sleep apnea at the same time. It is referred to as mixed sleep apnea or complex sleep apnea. Without treatment, sleep apnea can lead to high blood pressure, a higher risk of having a stroke, depression or mood changes, a risk of accidents due to tiredness, or difficulty concentrating. Sleep apnea can also be difficult for your partner and can put a strain on your relationship with them. In general, a person with sleep apnea is not aware of their breathing problems at night. For people who live alone, excessive daytime sleepiness is the most likely symptom they will notice. An overnight sleep study is usually required, and treatment is nightly use of a continuous positive airway pressure CPAP mask or a bilevel positive airway pressure mask with machine. These devices push air through an oxygen mask into the airway to keep it open during sleep. The definition of stridor is an abnormal, high-pitched musical breathing sound as a result of overactive vocal cord muscles that remain constricted when they should relax. It is a sign of upper airway obstruction. In MSA, this is usually caused by paralysis of the vocal cords. It is usually inspiratory and usually only at night. If left untreated, stridor can become a medical emergency. Persistent and severe stridor may require tracheostomy, but most stridor symptoms can be managed effectively. The main symptom of restless leg syndrome is an overwhelming urge to move your legs. It can also cause an unpleasant crawling or creeping sensation in the feet, calves, and thighs. The sensation is often worse in the evening or at night. Restless leg syndrome is a common condition that can affect anyone at any point in their life, but women are twice as likely to develop restless leg syndrome as men. It is also more common in middle age, although the symptoms can develop at any age, including childhood. There is also a link between restless leg syndrome and pregnancy. Mild cases of restless leg syndrome may not require any treatment other than making a few lifestyle changes, which include good sleep hygiene, stopping smoking, and regular exercise. If your symptoms are more severe, you may need medication to regulate the levels of dopamine and iron in your body. This might be a dopamine replacement medication, such as that used in Parkinson's, or if restless leg syndrome is caused by iron deficiency anemia, iron supplements may be all that is needed to treat the symptoms. You may find it difficult to turn over in bed or get into a comfortable position due to upper body rigidity. Talk to your occupational therapist about a slide sheet or similar that can help you to turn over. Satin pajamas or a nightdress may enable you to turn more easily, or satin sheets, but don't use both together. The occupational therapist can also supply a grab rail that slides under the mattress and allows you to pull yourself into a different position. They can provide a weight-shaped cushion if you have postural hypotension and need to sleep more upright, or depending on the type of bed, can raise the head of the bed for you, ideally a 30-degree head-up tilt. They can also advise you on the best type of mattress, especially if you are unable to move yourself at night. You may require a special mattress and a hospital-type bed to prevent pressure ulcers, sometimes referred to as pressure sores. Your community nurses can help advise you about where to obtain these. We have a fact sheet on equipment available on the MSA Trust website. Good sleep hygiene involves going to bed and getting up at the same time. Getting your body into a regular routine is important. If you can, avoid having lie-ins. This routine can also help to set your circadian rhythms. However, if you are fatigued, it can be helpful in MSA to have an afternoon sleep. Try to prepare for bed by winding down an hour before bedtime. Make a list of things that are worrying you or things you need to do tomorrow. Have a routine that prepares your mind for relaxation, such as a warm bath or shower. Do some yoga or stretches if you are able to. Try listening to some soothing music, a podcast, or a relaxation CD. Lavender and chamomile pure essential oils are good for aiding sleep. You can use these in massage, adding them to oil burners, or putting a few drops on your pillow. Avoid citrus oils as these are uplifting. You might wish to buy some earplugs or a sleep mask if noise or light are disturbing you. Your bedroom should be at a temperature between 18 to 24 degrees Celsius. It should be dark, quiet and tidy. Your bedroom should be a relaxing environment. Avoid using electronic devices an hour before bedtime. If you are a carer sleeping in another room, you might want to use a two-way monitor. If your pet sleeps in the room with you but wakes you often, consider moving their bed to another room. Pain relief may be required depending on the type of pain and the cause. Pain can be assessed by the neurologist or nurse specialist. If the pain cannot be managed routinely, referral to a pain clinic for assessment may be necessary. Management of pain can include both medication and non-medication methods, such as relaxation, the application of heat pads, and TENS machines. We have a fact sheet on complementary therapies on our MSA Trust website, which you may find helpful. Sleeping tablets are only really useful in the short term and can be addictive. They can also be problematic if the person needs to get up several times at night to pass urine, making them drowsy and more likely to fall. Melatonin is sometimes used to try to reset the sleep pattern. Muscle relaxants can be helpful for rigidity and nightmares, and also for REM sleep behaviour disorder. Restless leg syndrome can be treated with Parkinson's medication called dopamine agonists. Sleep apnea can be treated with a CPAP machine. Discuss these issues with your GP or neurologist. Don't put up with lack of sleep, as it can severely affect your well-being. You should contact your GP if your lack of sleep is affecting your daily life and lasts for more than 4 weeks. Nutrition and exercise have been talked about in the fatigue presentation, but if you are able to do some form of exercise each day, this will aid sleep. Avoid doing this in the evening. If you are able to get outdoors, the best time for exercise is mid-morning. Walking and swimming are particularly good at relieving muscle tension, as is hydrotherapy if you can access this locally. Seated exercises can also help to reduce muscle stiffness if done regularly. There are several Parkinson's exercises accessible online which can be beneficial in MSA. In summary, sleep issues are common in MSA and can be complex to manage. All of your MSA symptoms will be worse when your sleep is disturbed and when you are fatigued. Help is available to manage the sleep issues in MSA. Do seek help from your professional healthcare team to manage these symptoms. You may find these apps and websites helpful for further information. Our contact details are on your screen now. Thank you for listening today, and please do get in touch with us if you have any questions. This presentation contains basic information and is not a substitute for medical advice from your specialist. Please refer to our guide to MSA on our website for more in-depth information about the topics discussed